Informed consent is us explaining a procedure or anything that's going to be going on with you. We're explaining that, we're explaining the risks, benefits, and then giving you the opportunity to ask questions, do research on that, so that you're truly able to be informed of what we're doing, why we're doing, and that way you have a choice in, saying, yes, this is what I'm choosing for myself, or no, and then giving you alternatives as well.
Informed consent is very important. We always be sure that we obtain consent before doing anything. And that just looks like asking permission before we touch you in any way, before we do a blood draw. Anything that we're doing, we're going to make sure that you're well educated about the situation and that you have given us permission to take care of you and do those things.
Informed consent is a conversation between you and your provider. It takes place before any procedure that you have. It allows the provider to explain the risks and benefits of any procedure. It also allows you to ask any questions you have and for your provider to answer them. And it's important to facilitate a conversation and to have shared decision-making between the provider and then you, the client.
I need to be able to explain the risk versus benefit to people in a way that they understand. Informed consent is sharing of information and not being like, I think you should do this, so I'm going to steer you towards this thing. That means not necessarily signing some consent form in the moment. That means giving people the information and then sending them home with that to also think about that.
Informed consent is the process of ensuring clients have the information that they need to make their healthcare decisions. So informed consent then is saying, like, here are all of the options, and one of those options is always doing nothing as a piece of that informed consent. And it's okay for a provider to say, this is what I recommend and this is why I recommend it, but then kind of looping back to the client certainly to say, where are you in that? What additional information do you feel like you need to be able to make a decision? Making sure that the client has the opportunity to choose what works best for them and for their family.